First of all, thank you for those who are still here. It's been a long slog. We're the final ones. So Medical City had a good year in 2025. We've now grown to 6 hospitals, 110 clinics, 12,000 staff serving 3 million patients a year. But the most important number is 1. We're now under one brand. We're one academic medical system across the country, and we have one mission, which is really to treat all of our patients as partners. So I want to publicly thank Secretary Ted Herbosa, our excellent Department of Health, Dr. Edwin Mercado, PhilHealth, all of our corporate partners, but more importantly, to our frontline warriors and our back office angels who work 24/7 to make sure that we can provide patient care 365 days a year. They are the silent heroes of healthcare. I thank to all of them, I thank you to all of my team, and I thank you again to Healthcare Asia. Thank you very much.
Yeah, so in 2025 and coming into 2026, we became the first real academic health system in the Philippines. So we're now Joint Commission accredited as an academic medical center, as well as being a hospital group as JCI accredited. And we've really created the first unique integrated network of hospitals, clinics, which are serving both patients in the Philippines and in Guam, in Palau, and other Micronesian islands. And I would say that really the way we approach care, because it's fully integrated, we have the same IT systems, we have the same treatment paradigms, we have the same clinical protocols, the same doctors working in our hospitals and clinics, so that for the patient, irrespective of where they are in the Medical City network, they get the same quality of care, the same standard of care, and excellent clinical outcomes. So it applies to patients coming from Guam, from Marshall Islands, from Palau, all the other Micronesian countries. So really we've created a unique network of a very consistent clinical delivery network, I would say. So yeah, I think our approach to care is quite different. Through the hospitals and the clinics, so obviously healthcare is becoming increasingly expensive. And so we're working now with both cash payment patients as well as the HMOs and the insurance companies to really make sure that we, I would say, right-size healthcare delivery. So there's a lot of patients who traditionally come to hospitals, especially in the Philippines, when they could be better served in a clinic, especially with primary care needs. And because we have, 75 clinics across the country, we have another 25 to 30 corporate clinics. A lot of the care that's currently being delivered in hospitals, we're starting to push out of hospitals and into the primary care clinics. And the cost of care is, a third of the price or a quarter of the price. So, this year we're really making a concerted effort. And I think by shifting patients out of a hospital system, unless they really need hospital-led care, it reduces the cost of care without compromising at all on quality, because as I said before, we have the same doctors, the same clinical protocols. So ultimately we're delivering a very high standard of care, but really reducing the out-of-pocket cost to those patients who have to pay out of pocket, and also reducing the cost burden for our HMO partners. So actually we've had a very difficult year implementing the same IT system, the same electronic medical record in all of our hospitals and all of our clinics. And I think we're probably the first hospital group in the Philippines to have done that, if not one of the only groups in Asia to have done that. And that means that as a patient, if your first point of contact is a clinic, let's say, and you see a primary care doctor and you now need to go to the hospital, traditionally, you'd have to go and have the blood test done again, and maybe the hospital doesn't have access to your medical records. So now there's a very seamless transfer of the patient. For patients in Guam, for patients from Palau, we actually have made the effort to have the doctors in Guam have access to our medical records in the Philippines directly, so that whenever the patient's admitted to the hospital, on a daily basis, they can see exactly what's happening. They get a full medical record on discharge, and we really create a seamless care pathway. So, it's good for the patient. They don't get bled twice. They don't have twice as many blood tests done. And for the doctors, the care coordination is extremely streamlined. Yeah, so I think for the Medical City, I think the recognition is really, it reinforces that what we're doing makes sense. It also rewards the people who work incredibly hard, both on the front line and behind the scenes. I think it's good for the team to understand that what they're doing really makes a difference. And I think You know, the Philippines healthcare system is very underrated, especially compared to the rest of Asia. So I think it's important the Philippines hospitals and clinic groups are well represented in the rest of Asia. And so we will continue to do our best. We will continue to make sure that it's not just really about Medical City getting recognition, it's about the Philippines health system getting recognition, and for that we're very proud.